Hi guys, Audrey Jean here. It's been a minute since I've recorded. Just want to bring you up on a little life update. I am no longer on suspension. I went through my probation and I flew through it swimmingly. I did everything that was asked of me and then some, and I really just basically calmed down. So getting the Seroquel on board was definitely a must for me. It really helped kind of smooth things out like I said it was supposed to do, and that's really been a lifesaver for me. Now, let's talk about this situation going on here. This is a reaction from a medication. I usually put makeup on and look really nice, but I want to ask you guys too if this happens to you, because I always get very, very, very sick with really odd things. This is the fourth time I've had this specific bacteria in my colon, and it's so bad I have to be put on just very specific medications, and I reacted intensely from one of the medications. I've been to the ER twice in the last 2 nights because I had airway issues, and I had just this whole, I turned into one big hive. And last night I woke up, my eyes were swollen shut, so this, like, all these spots on my face are never here. This darkness under my eyes is never this bad, but just being in vain, just telling you why I kind of look like holy shit today. That's what's going on, but I did want to get a video up for y'all. Just to touch base and see how y'all doing. Made it through Thanksgiving. My Thanksgiving was awesome. I hope yours was too. I do know and have had certainly my fair share of really crappy holidays. Typically during the holiday season, I get very depressed, very, very, very depressed, and even suicidal pretty much every holiday season. But because of my husband and his family, things are just different this year. I said I honestly can't think of, in the last probably, let's see, 2, 3, 4, 5, almost 5 years I've gone to the ER. I want to say 4 to 8 times a year with weird illnesses, things that I've caught. And my question is that because we live under so much stress that our body is just so immunosuppressed that we get sick? Does that happen to you? Because it happens to me all the time. Like, seriously, you guys, my eyes were swollen shut, and I do not come on camera not all glammed up, because I want to give you the positivism and have you feel like you can be functional and go out and be how I try to be. And of course I have my down days. I always have my down days. For God's sakes, I've been a nurse for almost 25 years and I got suspended from a job. I mean, that was down. That was downtown Julie Brown. If you know what that means, you know who she is. You're old. Good for you. So I've sprayed calamine lotion all over this, and I just wanted to be real with y'all that I don't always look glammed up. I pretty much do, but I just wanted to be real with you all and let you see kind of what I'm going through. And have you experienced the same things with serious illnesses? No one has ever heard of one person my age getting this specific stomach bug 4 times. It does not happen. Someone might have a reoccurrence, and in that population that gets this bug, it's the elderly. They might have 1 reoccurrence. Otherwise, no, nobody gets 4. Nobody gets 4. But me, I get 4. So my gastroenterologist is so puzzled, and I can't even have a colonoscope until this is all cleared out, and he has me on antibiotics for 6 weeks, which is unheard of course. But I don't get anything normal illness-wise. Like, I don't get a cold. I don't get the flu. I get pneumonia, double lobe pneumonia. I get this stomach bug again. This is the second time I've had it in less than 6 months. The other 2 times was spread out over a couple of years, but they've been very serious and they were community acquired. This is something that's usually acquired through medication, such as antibiotics. So I just want to know, is that normal? Do you guys get sick a lot because you're run down because of your anxiety? I have so much anxiety all the time, and I do pretty well because I've learned to really fake it till you make it, just because of my profession. I can't be sad and I can't be glum and I can't be crabby or mad at people. Like last time we spoke, I was so hypomanic. I was just mad at people all the time. I wasn't mad at patients. I just really could have pictured myself hurting my coworkers that were just, I told you I don't tolerate stupid. But I don't feel that way anymore at all since I've had my medication changed. I don't feel that way at all, that I want to hurt her, like, not literally, but in my head, like, I just really want to hurt you because you're really stupid. I don't feel that way anymore. I tolerate her much better, and I've taught her a boundary that she can't cross either, and being a bully with me isn't going to work. I just have too strong of a personality. And when you're stupid and you're trying to be a bully, that's a really bad combination. When you're just being a bully, I can handle it and, you know, whatever. But stupid and bully, no, not happening. So I was just wondering if, gosh, if I could tell you all the things I've had. I'm in the hospital probably 6 times a year. Like a patient, inpatient, in the hospital for several days or a week at a time. You have to be really sick, like ill, to be put in the hospital for 7 days at a time. They kick people out. They don't just put people in the hospital. And I've had so many things, and I'm just tired of it. And it's caused me some job loss a couple of times because I was so, like the first time I got this illness, I was in the hospital for 2 weeks, and it took me 5 months to recover from. I had to take long-term disability, and I ended up quitting that job because it was too stressful. And that's where I first got this stomach thing that I'm dealing with now, and it was so serious. I coded. I was so sick. They had to bring me back to life. Paddles, ching, the whole thing. Yeah, it's a very serious illness. But I want to tell you that things are going great at my job. I love my job. I have a great routine going now. I've made it past my 90 days probation. I made it past the probation I was put on with my suspension. My boss was very happy with me that I didn't just, hightail it and run, because there are certainly people who it's easier, especially when you have as much experience as I do, can just be like, oh, screw you, I'm going to go get another job. I'm not a job hopper. I am in the sense that I've had trouble at jobs, so I've either had to leave, been fired, been suspended, and in the past, if I've been suspended or been like talked to or had a verbal warning or a written warning, I've always just left, because my ego would not allow that to be on my record at my place of business. And that's so stupid, because sometimes what I really learned from it this time is you are a problem. You're causing a problem. You're not being able to solve and just work. You're not doing things. You're not getting things. You're not doing right by, in my case, my patients. So you need to take a break and rest your brain. Think about the things that we're telling you are not getting done, or problems that are arising because you're not thinking clearly or whatever's going on. And I had to tell them some very personal things about me, which I don't want anyone at work to know, but they probably will, because they might watch this video. I don't know. I don't care anymore. Who knows? I don't care. I don't give a flying fuck what people think of me. I have people in my life who love me. I love them, and they are the most important people in my life. And I think that's the joy of the 40s. I turn 46 in a couple weeks, and you just don't, I just don't care. I want to be a positive person who comes across from my camera into your life, that you can be functional with bipolar 1 disorder. I also have PTSD. I have a dual diagnosis. You can be functional. You can be effective. You can live a life, be fine. Except for I get weird illnesses. So I feel like I'm either sometimes battling my bipolar, which is what I was doing at work and why I got suspended, or I get sick. It's just this hand-in-hand thing that goes together, and I'm like, just stop. Just be normal. And I do really well through the summer months. But it just seems like winter hits me hard. Although I was in the ER this summer too, so who are we kidding? And the hospital. So it just knows no bounds. Again, I just wanted to get up here quickly and say, I hope you all are doing well. I'm doing well, minus all of this greatness. Okay, so in my research, I had to put my glasses on, y'all. The situation going on is not attractive. I apologize. So in my research that I did, I found in the BJ Psych, which is the British Journal Psychological paper, kind of like the American Medical Association paper that comes out, or the JAMA Journal of American Medicine stuff. The BJ Psych is the UK version of what we have in doing clinical studies and research. And they came out with a study finding comorbidities, meaning having bipolar 1 or another anxiolytic, anxiety type ridden DSM categorized diagnosis, and a comorbidity are an illness, like a medical illness. A dual diagnosis is two psychological illnesses, me having PTSD and me having bipolar 1. So I have a dual diagnosis, as well as what can be hooked onto that are comorbid diagnoses. And this study has found it to be 3 times more likely for bipolar patients, or patients, especially bipolar patients who are rapid cyclers like I am. I'm up and down, up and down, up and down. I rapid cycle very quickly, very easily. Sometimes I feel still like I'm hypomanic at times, even though I'm on the Seroquel. I do feel a lot better, but I am able to just stop talking and not talk and just kind of tune everything out and take time for myself, where I wasn't able to do that before. The comorbidities that they were finding were customarily things like osteoarthritis, diabetes, type 1, type 2, asthma, migraines. What do I have? Hypothyroidism. Hypothyroid is very common among, like I said before, among bipolar patients because of the drug lithium. Oh, hypercholesterolemia, high cholesterol, I have that. I'm not on a medication for that because I am quite thin and active, so I'm not on medication for that. I don't need that, but my cholesterol is high. My cholesterol used to be 50. Like, nobody has a cholesterol of 50. That's so low when I was in my 20s, and now it's over 200. But I don't need to take medication for it yet. I just don't discuss that with doctors because I'm on so much medication. But they did find that because your body is run down, you're kind of going on this up and down, you're 3 times more likely to have a comorbidity. And a comorbidity being a more serious disease, not just, and what I have is very serious. But it's lived in my colon, and being able to be colonized over and over and over again, meaning it's something that is in my body commonly now. I did at one time, for 2 years, I was diagnosed with rheumatoid arthritis, not osteoarthritis. Rheumatoid arthritis is just a genetic factor. Osteoarthritis is something you get through time. of moving your joints and bones, and they kind of grind down. They don't have those fingers that go like this. That's rheumatoid arthritis when their fingers go like that. You know, they curve and they do that to the side. I was diagnosed with rheumatoid arthritis for 2 years, and I was on steroids and growth factors and all kinds of things, and it just like went away one day. And my psychiatrist was like, how does that happen? And I was going to the best doctors in Denver for my rheumatoid arthritis, and then in Lincoln, Nebraska, and they said you can just have a virus it mimics rheumatoid arthritis. And I'm like, so for 2 years I've been on rheumatoid drugs, I've had rheumatoid symptoms, and you're telling me it's a virus? And they were like, yeah, we are. I said, okay. And it went away, thank God, because I would probably weigh 250 pounds instead of 100 and what I weigh now. The top comorbid findings that they found were the 20 most common health problems: asthma, cancer, diabetes type 1 and type 2, hypercholesterolemia, elevated lipids, epilepsy, gastric ulcers, which I'm sure I have. We just haven't been able to do an endoscope because I have this illness in my body right now and my colon's inflamed. But I probably have some type of gastric illness. I have to, because it keeps coming back. But I won't know for another 6 weeks because I can't have an endoscope. Heart disease, which I developed at age 42. I developed a really rare form of heart disease that not very many people have. I can go into the ER and tell them the syndrome I have, and the ER doctor might not know. 1 out of 2 probably know. Usually the older doctors know what it is, not the younger doctors that are younger than me. A couple of them have, but I do have a heart condition. Osteoarthritis, osteoporosis. I do have osteoporosis, but I had a hysterectomy 11 years ago, so that could definitely be a part of it. It's also genetic because I am so thin. But I do have a very high, I'm on medication for osteoporosis. I have the bones of a 90-year-old. So when I fall, I break. Because last year I fell and broke my tailbone. And at Christmas time, this time last year. And then I fell again 2 weeks later and re-insulted it, and actually I injured I bruised my kidney and I bruised some ribs. So it's just like that thing I talk about with the domino effect of when things start in your life and like these dominoes start falling and going around and around in the circle and the pattern that they put out. That's just what happens to me all the time, and I want to know how many of you it afflicts. So anyway, osteoporosis, Parkinson's disease, rheumatoid arthritis, stroke, and thyroid disease is the big one. The group that they polled, they did age, gender. Every one of them had bipolar 1, and some of them had a unipolar diagnosis, which would be something like just depression. And they did show that people who were obese were afflicted much more, but that's in anybody who is obese is going to have more comorbidities than anyone, because obesity leads to high blood pressure, to diabetes, to hyperlipidemia, elevated cholesterol. It leads to a lot of different things, so that only makes sense. But the mean age was actually age 47, which is right where I'm at. And the development that the British Journal found of comorbidities and people having things in their life, having to go to the emergency room, having to go be treated for things all the time, was threefold than in an undiagnosed or not bipolar patient or unipolar patient, or patient with just one diagnosis of anxiety disorder or things like that. Interestingly though, they found that people who do have bipolar disorder, and I kind of knew this, are actually much higher on the IQ chart. Made me feel better. I don't know if I am. I doubt it. Probably not. I'm probably just normal. Interestingly enough, in this British Journal study, is they found that people who had 3 or more comorbidities only, not a psychological disorder necessarily, were actually more likely to have a psychological disorder when they had 3 or more comorbidities in the areas I talked about before. So let's say they're diabetic and they're diabetic, they have hypercholesterolemia, high cholesterol, and they have asthma. They were 3 times more likely. So the opposite is true. Not always, but it was an incidental finding that they could be more susceptible to having a psychological diagnosis. And I have to tell you, in 24 years of practice, I find that to not be too far-fetched. It was a study, I know, but people who are really, 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 really ill, when I thought about it, and I think about my patients over the years, that's true. Some of the sickest people who are sick all the time had mental illness too. It's just really interesting to me that you can get so sick, but it only makes sense because your body's run down or running on high octane all the time, being so anxious or or low octane, being depressed. It puts you in an immunosuppressive state all the time. Health-wise, I haven't, since summer, I've been doing so well. And I just go to the emergency room with weird stuff and I get put in the hospital. And I don't like it. And it's another part of this disease that is so unfair. Does not like, other diseases. Yeah, if you have cancer, you're gonna easily get sick from anything because you're so immunosuppressed. They a lot of times walk around with masks on, or they're in special negative airway rooms, so bugs stay out. They're in the hospital when they're getting treatment so that they're not around the general population. But people understand cancer. People understand and can sympathize with cancer. Not everybody gets bipolar is a disease just like any other disease, just like cancer. No, it's not cancer, and there's nothing comparable to cancer, but it's a disease. So is hypertension, so is asthma, so diabetes. Diabetes is one of the most serious illnesses I have witnessed in my life. I would rather be bipolar than have diabetes. And to have both is just an insult. I couldn't imagine. Diabetes is a terrible, terrible illness. So that's what this study found. It is comorbid. It's by BJ Psych. It's a paper called Comorbid Medical Illnesses in Bipolar Disorder. It's by Liz Forty, Anna Ulanova, Lisa Jones, Ian Jones, Catherine Gordon-Smith, and several others. The British Journal of Psychiatry, December 2014, page 6, 465 to chapter 6, pages 465 to 472. And it's a letter and declarations of interest. It shows all the data that I read to you, even more data that's more interesting, and I, make it relatable so that you can understand, and I speak to you hopefully in the verbiage is, easily understood. I hope. And if it's not, please let me know. Comment down in the sections below. If it's not, I can do better. I always want to do better. I want to do right by people. And I am here to do right by you, to other people in the community, to help people understand that bipolar does not have to be the end all be all, but we are fighting a fight unlike no other, that other people can't understand. I mean, I applied for disability. I have had a lot of jobs that I cannot do because of my illness. I have been working on and off for the last 5 years because of my bipolar disorder, and I was turned down for disability. Do I want to be on disability? No, I don't. I make a pretty good living. I enjoy what I enjoy. This room is going to be my beauty room because I wanted to do a YouTube channel for beauty because I love beauty and I want to do skincare and makeup for women my age. Is that going to happen? I don't know. Is that a grandiose thought process? Probably, because I told you I don't know anything about makeup, but I sure get a lot of compliments and I sure have been having a lot of people lately ask me to do their makeup, which makes me feel so good inside that maybe, and bipolar people are very creative. Comorbidities have been proven for bipolar patients and unipolar patients to be more prevalent, and it only makes sense that that's true because we are immunosuppressed because our bodies never adjust. It's just never, right here. It's just this up and down and up and down and up and down. Also in that study it said bipolar patients were more likely to lose 25 years of their life and die younger. And that's a scary. Please comment, let me know your experiences with comorbidities. Do you get sick more easily? If so, does it cause you to lose more days of work? And I haven't been fully, not truthful, but I haven't been fully forthcoming with my work yet because I'm new and I want to establish myself. I just got suspended or off suspension. I want to establish myself. I don't miss work unless I'm in the hospital. I don't. And I've missed work a couple times now because I went to work the other night covered in hives. My eyes were squinty. I got to go in late. I found someone to cover me late, and they sent me home because I had to go to the ER. So I miss work because I'm truthfully very ill, but it's caused by my body being so susceptible to anything. And just like I said, to have this bacteria I have in my stomach 4 times, you don't get this in my age group. You get it in the elderly. You get it in someone who's on antibiotics for a long time because they're sick. And I haven't been on antibiotics for a long time. I've gotten this is community acquired, meaning I've gotten it at work every time. And that's a scary thing for the medical community because this is not that type of disease. It's an institutional disease. Comment down below. I want to hear your struggles. I want to know if you go through the same thing. I want to hear all about you. I want to know everything that you're going through, or you've watched a loved one go through, or maybe you have a loved one who's bipolar and sick all the time and you're so frustrated. Because I know that my husband he's like, I pray for you every night that God will take away all your illnesses and you can just be. And I started to cry. I'm like, you really pray for that? And he said, yes, because you're sick all the time, honey, and I just want you to be okay. Because we have so much fun together. But when I'm sick, I can't participate in life. Like when I'm ill sick, I can't participate in life. When I'm mentally sick, it's hard to participate in life because I'm very agoraphobic. I don't want to go anywhere. And I love this man so much. And we are at a point in our lives, our children are all grown. We want to go do fun things together. It's that time to connect and be together. I hope this helps you because that is what it's meant to do. If you live this disease and you're trying to see if what you're going through is just any way, shape, or form like anyone else, you are just like anyone else. And it's okay. You're not alone. You're not alone. I'm here. I want to listen. I want to create a community where we have open dialogue and we can talk about the things that we experience or the things that you experience with your loved one and how hard it is to deal with. Because I know that my husband, when he's like, how many times in a year do you go to the ER? Audrey, I'm kind of getting sick of this. I'm kind of sick of you being so sick. And it's hard on me. It's hard on him. It's hard on him. He doesn't like getting up at 2 in the morning because I wake up with airway issues because I'm having a reaction to a medication and my eyes are swollen shut. And I have to go to the ER so that my throat doesn't close and I go into anaphylactic shock and die. Fun times. That you're not alone. You're not alone with your loved one who's bipolar. You're not alone with your loved one who has PTSD or depression or anything, because they can be lonely diseases that people want to hide because of the stigma. I want to break that stigma. That glass ceiling, yeah, I'm going to break it. You just hide and watch. You just hide and watch. One day you're going to say, holy shit, Fire Audrey, you did it. And you know what? If I have to do this for however long to reach as many people as possible, that would be such a blessing and such an opportunity for me to reach out to people and just help one person. If I can just help one of you on a certain day that's a bad day, my job here is done. I'm Audrey Jean, and that's a wrap. Have a blessed day. Go out. Be kind.